Okay, so let's get started. Getting the word out about Medicaid unwinding period. We are all from Covering Wisconsin, and we have had Maciel Gomez join us from the Department of Health Services, Wisconsin, so that we can make sure to answer as many of your questions as possible. So the presenters today are Caroline Gomez-Tom, who is the Enrollment Network and Accessibility Manager, myself, Stephanie Sievers, Insurance Literacy and Communications Manager, and Adam Van Spankeren, who is our Navigator Program Manager. So we will be watching the Q&A for any questions you may have. We may not answer them immediately, but we will take note and get back to them whenever we're able, or when it makes most sense to answer them. Okay, so what's on the agenda for today? We'll do a quick introduction to Covering Wisconsin and free enrollment help that's available throughout the state. We're going to talk about what the Medicaid unwinding period is, then move on to what people need to know. We'll talk about when people are not eligible anymore, what their options might be or what their next steps are. We're going to look at some coverage options for those who are no longer eligible. We're going to talk about how to spread the word in your community, and then we hopefully are going to answer your questions. Okay, so Covering Wisconsin is located at the UW-Madison. We're a division of Extension, and we help people find and use health insurance. All of our help is free as we are primarily grant funded. We've been a Navigator entity since 2014, and our expert health insurance navigators are federally funded to provide and licensed statewide to provide this service throughout the state. We also do education, outreach, and promotions. We consumer test all of our materials before we put them out or upload them up to our website. And all of our materials are freely available for anyone to download and use. Okay, so we'll get started with what is the Medicaid unwinding period. You're going to hear this word a lot, I believe. We're going to hear the unwinding. Okay, Adam?
Yep, perfect. Yeah, this is what everybody came for, I think. So they paid to see. So yes, we'll be saying unwinding quite a lot today, and it refers broadly to the steps that a state Medicaid agency has to take to replace temporary policies that were established during COVID-19 to make continuous eligibility possible, to going back to the regular eligibility, enrollment, benefits management processes. So in layman's terms, that is taking the state, taking all of the changes they had to do to make continuous eligibility possible, all the little administrative fixes they had to make that work, and going back to business as usual. Wisconsin's unwinding goals include to implement a successful return to routine operations. So that is that business as usual we're talking about. And most importantly, to keep Wisconsinites covered, to make sure everybody who absolutely can is on a state program, whether they're staying on a state program or should be on something else. They go on to insurance from their employer that they haven't been on during the continuous eligibility period, or they're going to jump on a plan from healthcare.gov. We'll talk about all of those things today. Next slide. So go into a little bit more detail about Medicaid and Badger Care during the COVID-19 pandemic. So COVID-19 pandemic, all Badger Care Plus and Medicaid renewals and terminations were paused. It means nobody had to do a renewal. Nobody had to process one either. So about 3 years of this where people were on Badger Care without any end in sight. Now, at the end of last year, Congress did pass the Consolidated Appropriations Act for 2023, which created a timeline for states to end this continuous coverage. That timeline may be something you've seen before in other presentations, maybe you've seen people refer to it, but now it's interesting because now we are actually in the timeline. It's begun, which is really interesting, and we're going to see some challenges with that. But key dates right now, renewal dates are being uploaded to Access and My Access. That is the state's benefits management portal. Letters are going out to members right now with renewal dates. Next date to keep in mind, we'll talk more about those renewal dates in a little bit, but dates to keep in mind, March 31st is the last day for people to get on Medicaid with the current continuous eligibility rules. meaning if somebody gets on Medicaid or Badger Care before the end of March, they're going to have continuous eligibility, meaning most likely they'll have at least 12 months staying on the program without needing to do a renewal. As of April 1st, then, we have the new Medicaid enrollees. They're going to be subject to the old pre-pandemic rules and do renewals as usual. That will be that return to business as usual. And then June, by the end of June, we'll have the first renewals actually beginning. So we'll have people who've received their 45-day renewal notice mid-May need to complete their renewal by June 30th. Next slide.
All right, so then I think this is where I take over. So we want to address why this is even something that we want to talk about during a webinar overview with over 500 of our closest community partners across the state of Wisconsin. And the reality is that there's challenges. This isn't something that is as simple as we have gone through a pandemic, there are these new policies, and now we're going back to how the policies were. There's obviously transition and information lost and learned over a period of time, now over 3 years that we've all been in this pandemic. And now we're trying to find a way and a process that we can collectively make sure that folks don't fall through the cracks and get to where they need to go. So one of the challenges is that renewal deadlines are spread out over 12 to 14 months, from June 30th, 2023 to May 31st, 2024. And that means that roughly 1/12 of the people that currently have Medicaid benefits will need to renew each month. And that is something that will be no small feat, because we also have more people enrolled in Medicaid than ever before. People can now actively find their renewal date by creating their account on access.wi.gov or going on their My Access app, which we're going to say a billion times today because we can't emphasize it enough. And one thing that we're also very concerned about is people renewing too soon. Because if people renew before it's their time to renew, they could lose benefits that they're eligible and qualified for earlier than they need to. What we really want folks to do, and we're going to say this many times as well, is we want them to know their renewal date and then wait until it's their time to actually renew. And so, as I mentioned, the challenge is we have more people that have been enrolled in Medicaid because of the pandemic, and we're able to maintain those benefits than ever before. We have 1.6 million people currently enrolled in Medicaid. Prior to the pandemic, that number on average hovered around 1.2 million people, which is going to mean a higher monthly renewal volume, because if you divide 1.6 million across 12 to 14 months. And obviously it's not going to be as clean as an exact number per month, but either way, it's going to be a high volume. And that means our partners at the income maintenance agencies that process these renewals, they're not going to be able to help every single person on the phone. So we have to make sure as enrollment assisters and key community partners that we know how to use access.wi.gov and the My Access app so that we can help people check for renewal dates, submit documents that are required through the renewal process, and then of course on access.wi.gov, complete the renewal. And this is something that we don't need to be licensed or specifically certified to help with. So that's why being able to connect with all of you and share that there are ways for you to help the community that will need to renew their Medicaid, that's going to be crucial. And I hope a big takeaway from today's event. And then additional a concern that we have is that it's really been over 3 years since anyone has had to complete the renewal process. So not just the Medicaid members themselves, but really any of us, IM agency partners, navigators, certified application counselors, we haven't had to do a renewal. So thankfully, the Department of Health Services, they've created some trainings that help refresh some of our experience with the Access and My Access resources. And then on April 4th, Covering Wisconsin will also be hosting a very specific training for enrollment assisters who want to help during this renewal process on kind of the guide step by step on how to renew and, of course, transition them to other coverage if needed.
Great, thanks, Caroline. And just a word on that April 4th training. You may have questions today that fall outside of scope. We've got a lot of community partners on, a lot of mobilizers. There's also a number of enrollment assisters. So if today you end up asking a question that we don't get to, or the complexity is a bit much for this presentation, we can definitely look into it at the April 4th presentation. Now, there is a group of people that we want to call out specifically that cannot renew. This is a group of members who got on Badger Care Medicaid at the beginning of the continuous eligibility rules, where there was some question about their eligibility status right when the rules kicked in. So they were on Badger Care and Medicaid, but they've been manually maintained and manually extended in the system since then. So what's going to happen for this particular population, they're getting letters in April. They need to reapply by May 31st. So they're not renewing. This group is reapplying for benefits. They may, like anyone else here, may not be eligible for Medicaid and may need to find other coverage. But this is the first group that needs to take action, and we just want to call that out specifically. Next slide. Now, we're going to talk a lot about people who are no longer eligible today. Robert Wood Johnson Foundation, the Urban Institute, estimate that about 300,000 Wisconsin Badger Care members might lose their coverage. And these are the people that we are going to need to transition to other health insurance coverage. These are the people who are especially interested in helping us navigate organization, but that people that you as mobilizers and community partners can help as well. Now, these folks, we're going to connect to other types of coverage. We mentioned this already, but employer-sponsored coverage for individuals who've been on Badger Care but have since had an offer of employer coverage that they haven't had to use. Others will be over income and will need to go to healthcare.gov. Others will be Medicare eligible, typically because they've turned 65. For folks that don't meet the qualifications for these other programs, for whatever reason, they're going to lose their coverage. There's still help for them. There are federally qualified health centers, or FQHCs, and there are free clinics that you can partner with and make sure you're making good referrals to as well. So nobody should be without help or the ability to get services at the end of this process. You can get free local help from an expert like me, like Caroline, our navigators. To do that, you could call 211. It's a great resource. Calling 211 to find enrollment assisters in your community, or you can go to wiscovered.com to learn more. Through Wiscovered, you'll be able to find, again, an enrollment assister and get to a place where you can sign up for an appointment online. Next slide. Now, how community partners, mobilizers, anyone can help. These are, as Caroline was saying, you don't always need to be an enrollment assister certified by the state to provide some help to these folks who are going to need to be transitioning off of Badger Care and Medicaid. And honestly, whatever support anyone can provide during this time is going to be valuable because, as Caroline said, the IM agencies are going to be tapped, resources will be spread across different communities and stretched. And really, this is going to be kind of full court press for helping consumers throughout the state. You can help people understand their letters and renewal dates. Specifically, we're seeing these letters go out now, and for at least, one person that we saw, it wasn't super apparent that their date was in April 2024. You get a letter in March, it says April, you're thinking next April. So pay special attention to the dates right now. And really, you can help members understand those. You can take the steps to help a consumer create an Access or My Access account. Check the renewal dates in the My Access app or online at access.wisconsin.gov. You might help an individual fill out the renewal paperwork or the online forms. If that's not in your purview, you can connect with other organizations who can help with the renewal process, organizations like Covering Wisconsin and our partners. You can connect people who are no longer eligible to partners. So you find out somebody who's no longer eligible for a program already, you can connect them to navigators or certified application counselors to help them sign up and get financial help, which is kind of our bread and butter. We'll talk about that more later. And then understanding that it's best to act before they lose coverage. We can make sure people don't become uninsured as a result of the continuous eligibility unwinding. Next slide. I think that's you, Caroline.
Yes. So what can people do? What do people need to know right now? We're going to try and make it really simple to help Medicaid members know when to act. So step one is to update contact information and to get those notifications. So going on access.wi.gov, going on My Access, making sure that they have an account that's linked up to their current Medicaid benefit case so that they can look up that information. Step two is finding that renewal date. Knowing what it is really the step, that's the key step right now, because they're currently at live as of February 19th in Access. They can also look up that renewal date in the My Access app, and then they're going to be getting those notices if they haven't already gotten them. And because of that, they'll know exactly when they need to do step three, which is act during their 45-day renewal period. And as we can't emphasize enough, people are going to have different renewal dates. This isn't going to be all at once. So it's going to be so important to look at that letter, to look at that renewal date in the app and find out exactly when that they'll need to get information together. And of course, anytime that someone has a question or a concern, they can call those local enrollment assisters by calling 211 or going on wiscover.com. I love to promote the My Access mobile app and how people should be creating an account. And it's also because it's not just for this renewal process. Actually, in the My Access app, you can't renew, but you can upload documents for the renewal. But additionally, it's where you can update contact information so people are getting those notifications and letters, whether it's in the mail or updated to their email. They can also update the correct phone number that they like to be contacted at. They'll get reminders. So once they know their renewal date, they're going to get a notice 45 days in advance, but the app will also send a push notification to say, hey, you're in your 45-day window. It's time for you to renew, so that people don't have to worry that they'll forget if they have this app. And then finally, I really appreciate this app because even if you are able to maintain your benefits and you are a Medicaid member beyond this renewal process, that you have access to your forward health card through this app. And a lot of people misplace it, and it's a process to try and get a new card. They'll have it right at their fingertips. So we wanted to kind of highlight through screenshots where to find the renewal date. So in the app, you would tap My Benefits, you would tap Badger Care Plus, look for the new renewal date. So as you can see in this second screenshot, it says your next renewal is due September 30th, 2023. And then of course, double check the year. So in this person's case, we'd be looking at in the fall for them to go through the renewal process. And that's another kind of ease of mind, right? Because people are going to be concerned if they think they're going to lose their benefits, if they think that they're going to lose their health care, because that's a difference between being able to fill your medications, being able to go see your doctor, being able to get the procedure that you've already spent however many months planning to have. And so we don't want people to go without all of that. So knowing exactly when they need to renew and when they need to act, that is going to hopefully bring power to them so that they know that their healthcare is in their own hands. And then in Access, similarly, people will be able to log in once they've created their account and go to the Renew My Benefits button. And when you go in that section, there's going to be a box that says benefits to renew later. And then it'll say the following benefits are not due for renewal until the date listed next to the benefit. If you want to renew these benefits now, check on the box, which we don't want them to do. Let's emphasize, we do not want them to renew now, but we do want them to acknowledge that their renewal date is at a later date. All right, and then I think I go back to Adam.
I think we momentarily lost our slides. There, they're back. Great. So they can go to access.wisconsin.gov to update their household information, including the income and assets. They may need to submit proof. And as we talked about, you could submit proof via the My Access app. The easiest way to do that is to take a picture of those documents. Once that's submitted, the local IM agency will be able to determine if they're still eligible and then send out notices of what to do next, verification checklist or denial, whatever that person's case may be. The IM agencies will process it and send out the letters. And for more information on just how to renew, kind of providing just a better breakdown of the steps and what people can expect is at the Forward Health/renewals page on the DHS website. So a link is there. There will also be a Covering Wisconsin sheet that we're working on. I think it's nearly done on how to renew, and that will go out soon. We can let everybody on this call know. It'll go out through our listserv. Next slide. So we talked a lot about people renewing. Many people will find out that they aren't eligible when they go to renew. Again, we want them to wait as long as possible so they keep their Badger Care benefits, their Medicaid benefits, right up until they absolutely can't anymore. But those people that are found ineligible, now what? What's next for them? Next slide. So we can always, we're here, so they can make a referral to an enrollment assister, like a navigator, like a certified application counselor, or an agent or broker. There are many agencies that have enrollment assisters on staff, whether Covering Wisconsin, you've got dedicated navigators, you've got federally qualified health centers and other providers that have CACs on staff. You've got agents and brokers working independently in the community. There's plenty of people to pick up this workload to help these members get other coverage. But remember that health insurance help should always be free. You should never be charged for the enrollment assistance you're receiving. A lot, we'll talk about scams and stuff later on. There are a lot of good people ready to help folks, and they should never be charged for that. Next slide. So going into a little bit more detail on health insurance navigators. We provide free help all year, so not just during open enrollment. We help people understand health insurance questions, whether they're really big, complex questions or just easy for us, small questions that they never had to encounter before. We help people find plans, the right plan for them, and the financial help, such as through tax credits on the Marketplace website, to be able to access that plan. So we'll sign people up or help them sign up through healthcare.gov or back through Access on the Badger Care Plus or Medicaid programs. We, say somebody's already got coverage and they're encountering different challenges later on with billing or coverage problems. Navigators will help with that. And we can always help people find community programs, financial assistance to help pay for insurance or medical care. We're going to cast a wide net and see what's out there to make sure those consumers get help. Next slide. So Covering Wisconsin, our navigator consortium throughout the state is bigger than ever. I'm proud of that, and also just really glad about what that means for community members, for consumers who are going to need help in this upcoming time. We have partnered with a number of agencies that you can see on the screen there. All of these agencies now have navigators. We're staffed throughout the state. We're able to provide assistance statewide. ABC for Rural Health, Central Respondent Dade County, Family Health Center Marshfield, Field Ignace Indian Health Center, Northwest SEP, Workforce Connections, Partnership Community Health Center, Progressive Community Health Center, and the Hispanic and Hmong Communications Network. Really just wanted to call all of those out because they're providing great work, and it's awesome to have so many navigators throughout the state, given how much of a lift this is going to be statewide. And Covering Wisconsin fills in those gaps, providing phone support whenever there isn't an obvious assister in that area. We can provide phone support and appointments anywhere in the state. Next slide. So finding enrollment assistance is really easy. You can schedule online through our website, coveringwi.org/enroll, or in Spanish. You'll be able to All of our navigators have schedules. You'll be able to see those and sign up for an appointment in real time. You can always call Covering Wisconsin, or you need help in Spanish, you can call Centro Hispano. And then we have a really awesome tool that we started in the last year or so, online through coveringwisconsin.org. That is our chatbot tool. You can actually do it from your phone. You can chat or you can text from your phone. And you can use it as a basic screener tool to figure out what you might qualify for. But that second option, getting free expert help and asking questions, you will actually be connected live to a navigator who is manning the chatbot, who'll be able to answer your questions or help direct you to the right website, and really just provide that consumer assistance in a new way that people previously couldn't benefit from. So we're just glad to be representing enrollment assistance in a new forum, new medium. Next slide. All right, back to Caroline, I think.
Yes. So now that we've gone through how people can get help when they may find themselves not eligible for Medicaid any longer, or just to get help for someone to help with the renewal process, we're going to kind of go into a slightly deeper dive of what those coverage options they would be transitioning to. So first, we would check for health insurance from a job. Because of the pandemic, people did not need to update their information to maintain their Medicaid coverage. And so that means there's probably a lot of folks that at some point maybe either lost their job or lost hours at their job, and then were found no longer eligible for employer coverage and were able to enroll in Medicaid. But now it's quite the opposite, where now they are working and they're back to either full-time capacity, or they're just getting paid higher than they were at the time that they initially enrolled in Medicaid, and they'll need to transition back or newly to employer-sponsored health insurance. And typically, we look at employer coverage before we look at anything else, because if someone is found eligible for affordable coverage through their employer, they may not qualify for other financial assistance through healthcare.gov, for example, and the health insurance marketplace. So we utilize the sheet that you see on the screen, the affordability worksheet, to determine if someone's health insurance through their employer is less than 9.12% of their household income. And that is to, based on the law, determine if it is considered affordable. And a recent update as of last year, as of this last open enrollment period, we now can look at that also for the cost of a family plan, to make sure that family members can also qualify for other types of coverage with financial assistance if the employer-sponsored plan is too expensive. But one thing that we want to emphasize, particularly about this transitional period, is that with employers, we typically don't have a whole lot of time to get people signed up through a special enrollment period. Normally, when someone loses any type of coverage and they're signing up newly for an employer-sponsored plan, they have a 30-day window. But one thing that we've uncovered, particularly under the HIPAA, which is the Health Insurance Portability and Accountability Act policy, there is a 60-day window for people who are losing Medicaid. So it's very specific to this population that we're talking about, who, when they renew, they may find themselves no longer eligible for Medicaid. They will have a 60-day window before and after the day that they lose coverage to enroll in their employer coverage. The challenge that we're experiencing with this is that many employers may not know that this extended enrollment period is something that they have to support with their employees. So one of the things that Covering Wisconsin is doing is we're working with key partners to connect with the State Health Resource, Human Resource Association, to help encourage them to reach out to their own employees across businesses to make sure that they know of the 60-day window for them to enroll in their employer coverage. But one thing we also want to encourage are for our partners and for the regional enrollment networks and for other players to talk to either local businesses or potential Chamber of Commerce and other places where we can share this information widely so that more people know about this 60-day window. All right, so the next is going to the marketplace, healthcare.gov. So typically, people can qualify for financial help based on their income and household size. And because of the pandemic, there's been additional financial help that's been available, and that help does not go away now. That actually is planned to continue through 2025. So really, we want to be helping people access this coverage if they're no longer eligible for Medicaid and they're not eligible for employer-sponsored care. And so anyone who loses Medicaid can sign up for healthcare.gov at any time before July 31st, 2024. This is actually a special enrollment period that was announced by the Centers for Medicare and Medicaid Services a few months ago for anyone who loses Medicaid coverage after March 31st, 2023 through July 31st, 2024. This is huge because it's going to allow anyone, even if they didn't know that they had to act right away, to get enrolled in marketplace coverage at any point in over the next year. And one of the things that we are also really encouraged by is that there's no requirement for verification of lost coverage. They just have to attest to losing Medicaid at the date that they lost it. And this is before or after the date that they lose coverage that they can enroll in Marketplace. We like to emphasize that in order to avoid gaps in coverage, people should be completing their healthcare.gov application before they lose their Medicaid coverage. So what really we want to see is people are submitting their renewals in their 45-day window. They find out in that process that maybe they're no longer eligible for Medicaid. And then before that last day of their coverage, they connect with an enrollment assister of some kind, or they can do it on their own by going to healthcare.gov and completing the application. But really, of course, there's folks that are able in the community to help them for free. And that's where we would want them to make sure that they can get the right financial assistance and they can pick the plan that suits them best. And I'm sorry, I just want to emphasize this one more time. By picking a plan, by signing up on healthcare.gov before the last day of Medicaid coverage, their coverage would start at the first of the next month, rather than having to wait till a later date. And then we're excited to say that we've updated all of these mentioned special enrollment periods on healthcare.gov, including the one relating to the Medicaid unwinding period on our sheet that can be found on coveringwi.org in our how-to sheet section. And we also have a link directly to the English special enrollment page. We will have a Spanish version as well shortly. And then finally, I do want to mention that there is a special enrollment period specific to Medicare. So for the folks that have been enrolled in Medicaid over these last 3 years, but have turned 65 between the time that they originally enrolled and now, they will have a special enrollment period for Medicare Part A and B of 6 months. And then for any Medicare Advantage plans or Part D prescription plans, they would have a 3-month special enrollment period. And then I transition back to Adam.
Great, thanks, Caroline. And I do just want to add on that last one because I did see a question come in about it. Navigators and certified application counselors are not, the certification does not include training for signing people for Medicare. So that is the one distinction I really like to draw about navigators and CACs is that we do not help with Medicare. When somebody comes to us and they're over 65 or otherwise eligible for Medicare, we connect them with assistance from ADRCs, the Medigap helpline, agents and brokers, whatever we need to do to connect that person to the expert that is the right person to enroll them. We absolutely do that, but we don't help with Medicare ourselves. But how to spread the word in your community? Next slide. So we have a lot of mobilizers, community agencies, different partners on the webinar, and you guys know your audience best. You guys know the consumers you work with best and the way to reach those community members. But just to give some ideas for you all to consider as you approach the continuous eligibility unwinding over the next few months. You can contact your existing consumers to share information via phone or home visits. You can certainly share the social media posts from Covering Wisconsin or DHS or OCI. If you have a lot of members that use social media, a lot of clients that do, it's a very easy way to get the information in front of them, especially if you are a trusted source that they're looking to. You can add this topic to discussions at community events. You've got meetings out in the community, certainly bring this up. The more public, the better. You can look for opportunities in your community newsletters or local papers or different organizational newsletters and post articles there. You can post flyers in that similar vein. You can post flyers and distribute outreach cards. Really, wherever your clients, your members, your people are showing up, putting that information right in front of them. And you can present to the community members themselves and other partners. So if you get on, get on their agendas, get on their meetings, you can certainly present some of this that we've been going over today so people know what's going on with the renewal process. And then depending on the level of service or capacity you provide, you might add a hold message reminding people to create a My Access account or providing other information about checking the renewal date, not renewing too soon. So these are just ideas to kind of jog everyone's imaginations on how they might help. But really anything you can do to get the right information in front of people, especially if you're a trusted partner and seen as a trusted partner by the community, that's the best you can do. Absolutely. Next slide.
Adam, if I could add, I know that, for example, Centro Hispano just scheduled an educational session to instruct members how to download the app and how to check for their renewal date. And they're combining it with a community event. So I thought that was a great way to teach people about that date.
That is a perfect example. Thanks, Stephanie. Back to Caroline.
And then another way that you can stay informed and stay involved and hear other strategies and ideas that other community partners are doing is to join your local enrollment network. This is an active link when you get the PowerPoint slide, so I hope that you go back here and click on it and sign up for your local enrollment network. We have 7 great colleagues of mine that are helping lead the enrollment networks. These are groups of community partners that are dedicated to making sure that access and enrollment is a priority in their region. We have folks from all different sectors, including our state partners, our federally qualified health centers, key community-based organizations, health systems, qualified health plans, and more involved at these levels. And we have currently 9 enrollment networks, regional, 8 of them are regional. The 9th one is our newest Latino enrollment network. And I'm excited to say too that we'll hopefully soon be starting our 10th enrollment network, which will be a Hmong enrollment network, where we can come together and talk through different strategies and ways to communicate this information that's relevant to our communities, but then also bring back trends and concerns that we see on the ground to the state so that the state can also be supportive of all of our efforts. And the goal for these enrollment networks, of course, is to have this Medicaid unwinding period be smooth and help hopefully reduce the number of anyone falling through the cracks, but also the goal is for them to be sustainable so that we're continuously keeping enrollment and access to coverage a priority for our state. So please join. And then I'm going to transition to Stephanie to go over a slew of resources that we want to make sure you have access to.
Thanks, Caroline. Okay, so I just wanted to highlight, and I know a lot of you are likely aware of this, but DHS has uploaded new materials to their Unwinding Partner Toolkit. So the types of things you can find there are ready to use flyers, social media tools, outreach cards, and more. And some of them are customizable. If you want, Covering Wisconsin also has some customized versions available on our toolkit, which I'll share the link with later. So. And I just want to highlight the example here. How to download the app will also be updated with how to find where, how to figure out where to find that renewal date will be on the back, as far as I understand. So we think this is a really great, important flyer to share out in the community. Okay, and then Covering Wisconsin has uploaded new toolkit materials. We have a couple cards ready to go right now with need help with health insurance, get free local help to renew, apply for coverage and financial help, or find financial help. And then just a need health insurance, get free local help. So on the back side of those outreach cards, it talks about Covering Wisconsin as an organization, but those are customizable for your organization with excuse me, sorry. They're customizable with your information, and you can also add your logo. So I think one of my partners here will be able to drop an email into the link of who you can email to get that information customized for your organization. And coming soon is the Office of the Commissioner of Insurance will have a toolkit, and so will MCAN. So those are coming soon. And once those are live, we will send out an email on the listserv to notify everyone. Okay, and as many of you are likely aware, Covering Wisconsin has a lot of informational how-to sheets on our website that can help you answer various questions. Of particular importance right now are options for your family. And I just want to remind everyone that if someone doesn't have an actual option that may be available to them once they lose, if they lose Medicaid, always remember we have a lot of community health centers and free clinics in our communities who are off. Probably a lot of members are here on this webinar. So let's not forget that that is a stopgap resource to help any members who may not have other options available. So you can also find more types of community resources listed in the County Community Resource Guide. So in addition to health insurance, it has 3 other pages. You can find information about where to apply for food programs or help with rent and various other programs that could be helpful in the community. So another great way to help stay informed and to spread the word is to follow on social media, Covering Wisconsin. We have both a Facebook and Twitter page. The Wisconsin Department of Health Services often posts a lot of great content. So they have both Facebook, Twitter, and Instagram. The Wisconsin Office of the Commissioner of Insurance, or OCI, has a Facebook and Twitter account, and then healthcare.gov. They also have a Facebook and Twitter for Spanish as well. So that would be cuidado de salud.gov. Sorry. Next one, please. Okay, so I know we talked a little bit, we already showed this slide, but it doesn't hurt to repeat. We're here to help. So that first one, the Find and Schedule Online, we call that the connector tool. That will help you find by zip code any of the help that might be out there in your local community. So I want to say that Covering Wisconsin allows for you can schedule an online appointment, but just look below that. You'll find phone numbers to call for local outreach in your region. So the nearest one you might have to call to schedule, but we have a lot of great community support. Oh, and then I just wanted to highlight, we have this tool on both the WisCovered and the Covering Wisconsin website. It's a health insurance web chat So in addition to a calculator for someone's income, they can kind of self-evaluate what program they might be eligible for if they're no longer eligible. They can also chat live with a navigator. This is a great option. For example, someone wants to fill out the forms by themselves, but may have a few questions about what the application is asking. They may not understand what it means or how to answer it. So we have navigators who are on there 9 to 4, 5 days a week. There's also some screening resources. This is available on both the Covering Wisconsin website, and Healthy MKE has the same tool. They call it the Saver tool. It's marketed a little bit different. I would just want to caution both the web chat tool on our website and this one have not yet been updated with the new FPL numbers that came out in February. They will be updated next week. So just a cautionary tale, but this is definitely another resource. It's 2 questions. So you just click how many people are in your household, and then you give a click for an income range. You don't even have to put the amount, just a range. DHS does have a very detailed screening tool, Am I Eligible, that will ask more detailed questions if people want to see if they're still going to qualify for Medicaid specifically. So, and that's linked here. All right, Adam. Oh, I did want to also mention that the outreach cards on the Covering Wisconsin website are not quite ready in Spanish, but maybe by tomorrow they'll be up and loaded. So.
All right. So talking about this, well, we always talk about during open enrollment or special enrollment periods. There are a lot of scams out there that are looking to take advantage of people who need health insurance. We see this a lot with Medicare. We see this a lot with people during open enrollment for healthcare.gov for the marketplace. Remember what I said earlier, is that help should always be free. You're going to get free, unbiased help from a navigator, CAC. If anyone charges or tries to charge somebody, that's a huge red flag. Nobody should ever be charged for connecting to health insurance. Now, before sharing personal information, so these are things you want to have consumers you help keep in mind. You can have them ask if they're licensed or certified by the state of Wisconsin or the federal government to provide insurance help. You can ask for a license number or to see their certificate for doing this work. And you can ask if something smells off and you're working with an assistant who doesn't seem to be presenting everything. You can always ask if they're showing you all of the insurance options in case they get some sort of commission or kickbacks from particular plans and you want to avoid that. Honestly, there's one I throw on this list because I find things like the license number or the certificate to be a little abstract. I think a good question that consumers can easily take away is if you ask the person, if it's a phone call, if you ask them where they're located. That should be a fast answer, and the answer should be somewhere in Wisconsin, typically. And if there's any resistance on that question at all, you typically hang up the phone because it's probably a bad actor. Now, when somebody's working on their own to apply for Badger Care, renew their Badger Care benefits or Medicaid, or they're applying for coverage through the marketplace, they want to remember, first and foremost, that it is a .gov website. All the .coms out there are there to get people's information and to have them sign up for different things like short-term plans if they're not scamming them outright. So it's healthcare.gov or access.wisconsin.gov. And at this point, I'd like to take just a second to scare folks. And I want to do that because community organizations and mobilizers, you are the trusted resources that people are going to go to if you're in a position to provide good information and to help people from falling into these scams and traps. I just like everybody to take this seriously because this is going to be unprecedented. This is so many people have to act and so many people are going to be confused, and hopefully we're arming you with enough information on how to reduce that confusion out there. But think about bad actors and scammers. They could literally set up an auto dialer, call everybody in Wisconsin, and 1 in 5 people are going to be Medicaid members who are going to need to renew. So that's just a scope. That's the scope of how many people could be affected and how many targets there are for these bad actors out there. So do everything you can to put good information in people's hands. We really don't want to see people taking advantage of it this time, and there's free, unbiased help available for everybody. So absolutely do what you can to protect your people. If you want to report a scam to Wisconsin Department of Agriculture, Trade, and Consumer Protection, that number is on the screen. Next slide. Oh, go ahead.
Adam, just to add, because I think you really emphasized it well, we should be empowering the consumers that we serve as well, so that they are just being cautious. So I would always recommend folks, if they get a call directly to them asking for information, to write down the number, ask where they're calling from, ask the name, and take down the time, because there will be some circumstances where it might be someone in good faith actually trying to help, but many times it could not be, and it could be someone a bad actor, as Adam has said. So making sure we can keep that information tracked, just so that if we do need to report it, if the person does feel that it's a concerning phone call, that we can act on it.
Yeah, thanks. I love that, Caroline. And especially important for DATCAP, Department of Agriculture, Trade, Consumer Protection, and OCI. A lot of times the Office of the Commissioner of Insurance is going to be the agency that's going to help people with this. So getting that name, getting that number, getting that time of day, that's all going to be relevant and help them look into it. Next slide. So we've talked about this, but things you can do as we approach the end of this presentation, we're going to get into the Q&A. Lots of exciting questions have come through, but things you can do today: you can spread the word, make sure people know that they're to update their contact information so they can get notifications about the renewal dates. You can show them now where to find the renewal dates. They've been live since February 19th in Access. So you've got a couple different places you can point them to, and to act during the renewal period, not too soon. So we want to find the renewal date and then wait for their actual renewal window. You could offer consumers help through your organization, or, depending on what your organization's scope is, by referring Covering Wisconsin or other sisters, CACs, and other orgs out there. You can connect with others in your community through your regional enrollment network, and just connect with other partners as well, just to make sure everybody has good information on this, because it's going to be quite the time we have ahead of us in the next 14, 16 months coming up. Yeah. Next slide. All right, we are at questions.
Okay, we've had quite a few questions come through, and I know probably Maciel will answer a good portion of these as well. So I'll start asking, and we'll see who picks it up. Has DHS shared what will happen to members who renew early and are still eligible? Will they just retain their eligibility and have that as their new renewal date?
Great question, topic. This has been bubbling up because I found out that folks can actually select renew now on their access application, on their access program. And we're just trying to get the word out to get folks to understand, don't do it. If an individual decides for whatever reason that they would like to go ahead and do the renewal early, we're trying to stop that. But in the meantime, if they do, the only form of eligibility that they would continue to have would be up until the end of May, because that's what we've been saying. Nobody needs to do anything or will lose eligibility until the end of May. If they did the renewal early, we can only keep them eligible until the end of May. That means, say for instance, I, Maciel Gomez, had a renewal date for April of 2024. And today I got nervous and I logged into Access and I said, the media is telling me that I'm going to lose eligibility and I have to take action now. And I do that. The way that I would get eligibility would be, and I'm determined, sorry, I should finish that sentence, and I'm determined no longer eligible for Medicaid because of my income or what have you. I will only have eligibility until the end of May 2023 and will lose the Medicaid eligibility that I would have had kept all the way up until April of 2024. So the answer to that question, very long-winded, but very technical, this is why I'm being long-winded, is if anyone does their renewal early and is found no longer eligible for Medicaid, we have to cut them early, bottom line. What we're asking folks to do is don't act until you have to, because number one, we want to make sure that the workflow is manageable for all the IM agencies and for all the clients to be able to get their information timely together from their employer, what have you, to do the renewals. But if an individual chooses to go ahead and do that, they will lose their eligibility early, and the latest that they can keep their Medicaid eligibility under the continued eligibility would be the end of May.
Okay, thank you. And then who are the groups that need to reapply? So this was in reference to there's a group of people who will need to reapply by May 31st.
Absolutely. Those individuals who were telling you can't renew, you have to reapply, are those individuals who have been manually extended with Badger Care Plus or Medicaid throughout the duration of our extensions and have lost a healthcare case in our CARES system. So these are individuals that we call the IC only population that are in the Forward Health portal. You can see their eligibility is open, but they don't have a CARES case any longer in our care system, which when I say care system, it's the system that the income maintenance agencies consortiums use to house their case and make sure that they're checking their eligibility, they have their addresses, all that. They would have to actually initiate a new application so we can actually redetermine to see whether or not they're eligible for coverage. And they can be found eligible and have a new case in the care system, or they can be told you no longer qualify. But we won't know unless they tell us, and by doing so, they need to reapply.
Thank you. And then are Medicaid members notified of their renewals only by mailed letters and online, or are there email and text notifications?
Yes. I had to check it. I loved Teams for this, so I had to check with my colleagues to make sure that I was correct on these answers. And we will certainly be notifying folks of their renewal dates via letters, but also we have already populated the renewal dates in their Access and My Access accounts. And we will also have text messaging and email campaigns to go ahead and notify folks when their 45-day notice is coming out to let them know, hey, you need to do a renewal. And that's, we're trying to get the word out as much as we can.
Great. And then can we get the what to expect at renewal time PDF and or other helpful flyers to post in shelters, other public social service places? I'm trying to remember.
Is that our document or yours?
I'm not sure. If it's a Covering Wisconsin document, go ahead and reach out to me, and I can work with you and connect you, even maybe with an enrollment navigator who can help you post in some of the places that you would like to post. Okay.
And if it's for DHS, just let Stephanie know. We'll work it out. Just
Yeah.
know it's a team effort here, folks.
That's true. You can also let me know. Is there any priority, for example, order of to the assigned renewal dates?
What we're doing right now is we're tying renewal dates to any existing child care case in the CARES program, food share case, things of that nature. So what we're trying to do is we're trying to extend the coverage to the latest part of the renewal. So we're just trying to go ahead and do that, but that work has already been done and the renewal dates have already been assigned. So there is no high priority as far as population and such. It's just how could we piggyback and then do the assignments that way.
Great. I believe this one's for Adam. Why were all the member organizations listed on the consortium list?
Yeah, and not to be confused with the IM consortia, which the income maintenance groups for different parts of the state, that was referring specifically to our broader navigator network. So covering Wisconsin and all those agencies were agencies that also have navigators and can provide local assistance in their different areas throughout the state. And I'm actually glad that this came up because there was one that wasn't on that list, which is one of our newer partners. The Finley Foundation also has navigators and will be helping people moving forward too. So I was remiss to not mention the Finley Foundation earlier. So I apologize for that. But yeah, so that's where navigators are throughout the state.
Okay, and just to remind people that navigators work year round on this. There are a lot of people in the CAC, Certified Application Counselor, who also not work year round. So it just depends on the organization. So, and the best way to find whoever's in your area, whether they be a navigator or CAC, is the connector tool that's on the Covering Wisconsin website. Okay. Let's see, is there any official document enrollment assisters can use to help educate the community or businesses on the HIPAA law regarding the 60-day enrollment period for people who lose Medicaid?
Yeah, I wanted to take this one. So I have not found that official document yet. We kind of had to uncover this a little bit to figure out the 60 days for Medicaid members. But that said, this is a project of mine that I'm really committed to right now. Finding out how we can let employers know, how we can let HR departments know, work through chambers of commerce. So I have every intention of creating something like that community partners can use, working on memos and newsletters for different employer groups. So as I suppose you could, people on this list, we could probably send something out to. Stephanie, would that be the best way to do it?
Yeah, and we can also send it via the listserv as well.
Perfect.
Adam, is the Center for Budget Policy, you know which
policy priorities? Yeah.
Yes, thank you. Are they also creating a document?
Yeah, I'm working with them on it actually.
Oh, okay, great. It's my understanding that the SEP or special enrollment time period starts when a person goes on healthcare.gov and completes their application. They have 60 days to enroll in a plan. Is that correct? And if so, what if they complete the app but don't enroll in time?
Caroline, do you want to take this one? You've been quiet.
Yeah, I'm happy to.
Yeah.
So yes, the person is understanding it correctly. So typically when you start the enrollment process on healthcare.gov and complete the actual application, that's when there is a 60-day window to select a plan. And if they technically do not select a plan within that 60-day window, that special enrollment period has ended. I don't know exactly how it will work out because there is this extended special enrollment period for people losing Medicaid. If you would be able to go back in and reapply and then select the date that you lost coverage and still trigger a new special enrollment period, I feel like we'll find that out in actual action. But what we will encourage are for people not to wait to select a plan. Of course, you know, people can take their time, they can look over their options, they can take a day or two, but the reality is we want people to make sure that they're selecting something in a timely fashion to make sure their coverage starts right away, especially if they're doing it right after they lose or right before they lose their coverage so that there's no lapse in coverage.
I would also add they could work with an enrollment assister to understand their options of what plan might be best for them.
Absolutely.
Has Covering Wisconsin estimated or is aware of estimates of the numbers of disenrollees who will turn to the various options for new coverage?
So there was a slide earlier in the presentation. We pulled some numbers from the Robert Wood Johnson Foundation, and it should be in the neighborhood. So it's an estimate, right? There are a lot of people we're talking about being affected. So it's just an estimate of around 300,000 that will need other forms of coverage. But I would put a caveat on that and say that it could be more, like it could definitely be more than that.
And there is a significant amount of them who will go to an employer sponsored plan.
Right.
Don't quite know yet. So
yeah, it's to remember the group has options. They have options, this group. So they're not going to be left with nothing. This is just a group we're talking about that we as assisters are going to be in the best position to help.
Okay. If members call their HMO and then ask how to re-enroll, can the HMO staff talk them through what they need to do on the access application?
So this is a great question. HMO should be either referring folks to Covering Wisconsin or referring folks to utilize the Access website and things of that nature. As far as walking them through and do the enrollment and such, no. They're just, the best thing is that the HMOs are able to go ahead and reach out to folks. Folks should recognize that that's their HMO and a trusted figure to be able to say, oh, I need to take action and do my renewal. But thereafter, we're definitely going to allow them, because Access is pretty intuitive, so to be able to do that particular renewal. However, walking them through, hand-holding them to do the renewal itself.
Okay, great. And from Julia, a navigator or CAC will never record a conversation or record your verbal signature to lock you into enrolling in a product. Many people are scammed in this way. And I think, Adam, you wanted to add some comments.
Yeah, honestly, I thought just that was a great comment by Julia, so I want to make sure we talked about it. But honestly, just with that, if the agent, whoever they're talking to on the phone, if they're coming on strong, that's a big red flag. You know, a navigator and assisters out here to guide you, to answer your questions. If they're trying to push anything on you, then hang up the phone.
Okay, I'm not sure I understand the next question. I'll read it out loud and maybe we can all interpret it. Hi, Maciel. Immigrant, refugee, asylee, comma, SIM immigration status, question mark.
So that's probably, I was having trouble with the question and answers. I was like, they were asking a question too vague. Can you provide info? And when they provided info, I don't know which question that was tied to.
Okay.
I have a feeling that one was asking about, are there certain
underneath
populations that, did they
immigration visa? Okay.
Okay, well, the question was originally, and I believe this is tied to that, are there any specific populations that would be either exempt from doing a renewal or something to that effect? Honestly, I would need the full question to bring it back.
Okay, all right, so that was Mike. Maybe Mike, you could retype the full question and
or send it to the Forward Health Partner inbox. That would be great.
Absolutely. Okay, is the renewal date the beginning of the 45-day renewal period or the end of the 45-day renewal period? I think we're going to get this a lot.
When the department talks about the renewal date, it's the renewal needs to be done by that date before you lose coverage. So go ahead, Adam.
I was just saying they're going to get that letter 45 days, 45 days before that. So that's the period, the date ends it.
And it's typically the same deadline for the renewal and also the date that you would lose coverage if you don't complete the renewal.
Right.
So I know that the DHS communications team is going to start doing a little more education about what is that 45-day window? What is that when we talk about that? Because it is rather confusing for people. So watch for other materials to be loaded on that partner website.
Partner website. We also have a dedicated renewal page that goes through how do they do a renewal, all of that. We've done a lot of work to be able to coach folks. It's been 3.5 years in the making. So definitely want to make sure that when we do send out the notes or whatever, we send out those important links as well.
Okay, and then in reference to what Maciel's talking about, I'm not sure what that was, about those who are turning 65, let's say May 23rd, and we know that they qualify for a QMB or an SLMB, and they are currently on Badger Care, and the renewal isn't due until the fall of 2023. What do you suggest?
They have a special enrollment period, but what I would really suggest that they do is talk to their local ADRC. Just to be able to get educated on what's available to them, not just health-wise, but let's just make sure the whole kit and caboodle is addressed.
Absolutely. And I would add that Medicare is its own beast and they'll need time to learn and make choices about what they're signing up for. So,
and I think this is a good reminder too. So for folks that are currently in Medicaid and they're trying to get their renewal date and they're trying to figure out what their next steps are. Yes, we do not want them to renew early. We've said that a lot, but they can ask for help at any point to kind of
Information.
figure out what their next step is. People do not need to go at this alone, and they can plan for when they do need to act with an enrollment assister. And so we could help them get connected to the ADRC, for example, to kind of figure out what this transition would look like. Or we can help them look at marketplace plans in advance to see what the cost would look like. We could help estimate their income. We would still help with the renewal process, but we can kind of figure out what the opportunities or what the next steps would look like so that people don't feel like they're in the dark.
Absolutely. Okay, and then of the 300,000 estimated to lose eligibility, do we know if they're adults, children, combination? We don't know.
Yeah, Maciel is shaking her head. I don't think we have a clear answer on that. I would expect there would be more adults than not, just based on the eligibility guidelines. But yeah, that's just information we don't have a clear picture of yet.
And then do we know, the question is there a forecast of disenrollment for the IC only individuals? I assume people are looking for numbers of how many people will need to reapply in May.
We're not alone in looking at the numbers and wanting numbers. I unfortunately don't have the IC only numbers on me right now. So that one I would definitely have to bring back.
Okay. Great. And then I work as an insurance agent with an employer group that employs many individuals that have Medicaid coverage currently. The employer cannot require those employees to submit their renewals early to try to determine eligibility for all those individuals at once, correct? No. I see Maciel shaking her head, but no.
That sounds like bad business, but I'll let you guys answer that.
Thank you. And then Karen, in the question and answer, did link, Karen works for DHS. She linked the renewal flyer so that you can just click on it and get it. It's available in English, Spanish, and Hmong. In what case would people need to renew monthly? Would they be notified of this in the letter or app? I think maybe someone misinterpreted the IC only population answer, that DHS staff are renewing them monthly.
Yeah, okay, so let's just break it down to avoid any confusion. So with the unwinding effort, we will have 12 months to do the work that needs to be done to get everybody to do the renewals or to reapply for benefits. Well, not to reapply for benefits, but to do the renewals. So each month, we're going to send out 45-day notices to folks to go ahead and do the renewals. Renewals and eligibility for Badger Care Plus or Medicaid typically lasts 12 months. So there isn't a need to apply every month for something. So unless there's a specific question there or clarification that they need, maybe they can send us an email and detailing that out. That would be helpful.
I think it's important that members don't have to renew every month. That's not the case. That was a behind the scenes.
I could dive into express enrollment because that can get a little kinky on that, and Adam's smiling here, but yeah. Let's take that offline because we have 294 people on the call and I don't know.
Okay. After someone submits their documentation for re-enrollment or to verify eligibility before their renewal date, how many days can they expect a response, or if they are not eligible for Medicaid?
It depends. That question, it depends. So I would just go ahead. If it's an individual who's nervous about having to apply with the marketplace, because that's kind of what it sounds like they're expecting to be denied for coverage and needing to take another step in applying for different coverage, I would contact your local CAC for some guidance on that.
Great. And then somebody was wondering how we're differentiating between a navigator and a CAC. So
sure. And on that last one, Maciel, agencies have, so the maximum amount of time, they have 30 days to process application.
Sure.
That's okay. I just think that it might actually, it's been sooner a lot in the past several years, but it might actually start pushing that limit again, just based on workload.
And can I add one thing too to that?
Of course.
If the person is worried about this, in the sense of maybe finding themselves not eligible for Medicaid after the renewal and wanting to get onto the marketplace, for example, if they're working with an enrollment assister, navigator, or CAC, they could start the application process, as we mentioned, because we don't have to pick a plan within that 60-day window. So we could have that all ready to go so that we can make sure that their coverage starts right away, but then hold off until we know for sure if they got, if their Medicaid is, retained for the next year, or if we need to transition that folk over. So like I said, it's best to get connected to an enrollment assister to make sure that we're doing the steps needed to make sure that there really are no gaps in coverage.
Yeah, that's why I was leaning towards when I was listening to that question. I really think they're worried about that special enrollment period. But yeah, to Adam's point, none of our regulations, guidelines, none of that has changed. The only thing is we're starting renewals again, folks. That's the only thing that's really changed.
So there's some letters here. I'm not sure exactly what it's referencing, so maybe you can help us out. I have noticed that AE-T-19 coverage.
Oh, wait, can I answer the CAC Navigator question? We don't want it to get lost.
Yes.
No, it's okay.
Okay.
I took us a different direction. So CACs and navigators have really similar training, really similar functions in terms of helping people apply for and understand programs like Medicaid and marketplace enrollment. Now, there are slight differences. Navigators get a little bit extra training at the federal level and do more outreach and enrollment to the community. So you tend to have a broader scope, where the CAC organization might be limited to the patients at that particular clinic or hospital, or just to that community. But the differentiation in name, navigators specifically are funded by the federal Navigator grant, which also entails this extra outreach and extra education that we provide as navigators. So we tend to have a broader scope, and you should find probably that navigators are a little bit more comfortable doing complex cases, including submitting appeals and things like that. But both are incredibly valuable and incredibly needed in this process ahead of us.
Okay, and then on to the AE-T-19 coverage. It's been ongoing for our patients. Will there be a date that these individuals will have their coverage stop? I'm not familiar with that program, so.
I believe that's alien emergency Medicaid. So emergency services for people who are either undocumented or other immigration statuses that don't qualify for Medicaid directly.
And what's the question tied to that?
Do we know the date that they will have their coverage end?
I believe that would fall under the IC only population, and they're going to be the first population that we're going to ask to do applications to redetermine. So it won't be soon after, it won't be too long after that first run of applications.
Okay. Of the approximately 1.6 million currently covered by Badger Care, are there any people or groups of people exempted from the renewal process for any reason?
I think that's tied to the other question that you were kind of giving us additional feedback on.
Yeah.
But let's take that back.
Okay. So and then, sorry, my questions.
There were a couple live ones.
When a Medicaid member gets their renewal between now and May 31st, 2024, will that be their new renewal date going forward?
I need to take that back. I believe it will, but because essentially what we're doing is we're restarting the clock. We're staggering them for 12 months, and it just makes sense to continue going forward unless they do a change in their case, they lose eligibility, apply again. So I believe so, but let's just take that back so I'm not just answering something I didn't check with policy.
Great. And there was something listed by an anonymous attendee. I don't know if you want to review that, Maciel, to make sure that that is indeed DHS.
I think that's they're sharing the methodology for how the renewal dates were decided. And so I'm pretty familiar with it, and
Okay.
it does look correct, so that they prioritized first that people had at least 12 months of coverage before their renewal date. Then they tried to align renewal dates with people within a household, so that they were all renewing at the same time. And then they would align the renewal date with their food share renewal dates, if that was applicable. Then fourth, they aligned their renewal with any childcare renewal dates that are applicable. And then the fifth item in order of operations is how much time has passed and dividing the number of renewals required over this 12 to 14 month period.
Thank you, Anonymous.
Yeah, I wasn't sure who posted it, so needed to check the validity. So, and there's another comment from anonymous attendee. Later this month, DHS will start mailing a last round of letters to a group of less than 2,000 members who cannot stay eligible past the 5/31/23 date. So that's May 31st, unless they verify their citizenship, immigration status, or identity. They extended continuous coverage to these members based on federal guidelines, but those same federal requirements restrict them from assigning a renewal date to those members. Instead, they must get verification of citizenship, immigration status, or identity. I don't know if you want to comment, Maciel.
No, that's 100% correct. And
Okay, it
Yeah.
looked like policy speak, so it sounded correct.
it does.
All right.
And those letters have already gone out, right? To that group, Maciel?
I believe so. There are so many letters going on right now. We're being recorded and I don't want to say yes and having someone say no. It
No,
wasn't.
I hear you.
Mhm.
But just to emphasize though, that's not necessarily people of varying immigrant statuses. That could be people who are citizens as well that just need to submit that verification. So just know that group of 2,000 could be anyone asking for help.
And then I believe we answered the other questions. So are there any additional questions?
Can you see any of the ones that we or I specifically said I'd like to answer live?
Yeah, I did ask
You
them.
did. Okay, good. I just want to make sure.
Yeah. And then I don't know if Adam or Caroline have any sort of closing comments. I know we have a survey we would like you to fill out that helps us with our being able to offer these presentations.
And that'll be in the chat, or I'm sorry, not in the chat. If someone can actually share that in the chat, that would be wonderful.
I can.
Thank you, Adam. But we really would love to hear your feedback on how this presentation went. It's the first of a few that we'll be doing in the near future. The April 4th enrollment assister specific deeper dive into Medicaid unwinding will be happening. So really all of your feedback and support and questions will help us make sure that we're improving each presentation as we go.
And then Maciel, for the questions that you're taking back, how can the participants learn of the answers?
Well, I'm going to be working with Covering Wisconsin to provide those questions because they're going to be providing me with what is in the chat so that we can capture those questions. So please know this is a team effort. The department definitely supports what Covering Wisconsin is doing here. We want to make sure that the information that you receive is accurate. And I'm sure there will be something similar to the conference that they hold. We usually provide them answers and they send up a follow-up or post it.
Great.
Yeah, and then I would say for you assisters out there, mark April 4th on your calendar for that deeper dive. We'll be talking about access and complex questions and all that stuff. We'll get that invite out soon.
All right.
And we're just a minute over, so
Yeah.
perfect.
Thank you, everyone, for attending
Thanks.
today's webinar. Again, all the slides and the recorded presentation in its 3 or 4 segments will be shared with everyone. And feel free to email either Adam or Caroline with any additional questions, and any questions about resources, I can field those. So thank you, everyone.
All right. Thanks, everybody.
Have a great day. Thank you.
You too. Bye.